Amid the standoff between the government and doctors over the medical school admissions quota, Prime Minister Han Duck-soo held a meeting with the directors of the country's 5 major hospitals this afternoon. Meanwhile, health officials unveiled new support initiatives for pediatricians. Hye-ryeon has details.
Amid the mass resignation of trainee doctors and medical school professors to protest the government's decision to increase the student quota for medical schools, the Prime Minister met with hospital chiefs in an attempt to find a way out of the situation. On Friday, Prime Minister Han met with the directors of the country's biggest hospitals, commonly dubbed the Big Five, namely Seoul National University, Yonsei Severance and St hospitals, and Samsung and Seoul Asan medical centers. He asked the hospital chiefs to play a mediating role and convince doctors to return to their posts, saying that continued efforts from the government to communicate with them had been unsuccessful thus far. On the same day, measures to improve working conditions for doctors were also introduced. The Ministry of Health and Welfare followed up on recommendations from a Central Disaster Management Headquarters meeting, which advocated new measures for the pediatric care system, such as increasing payments to doctors performing high-risk neonatal surgery. Additionally, pediatricians can now apply for extra compensation for treating children up to 6 years old, which was previously only available for the treatment of premature babies and those up to the age of 1. The Health Ministry will also set aside an annual budget of 67 billion Korean won, or just under $50 million, for the effective treatment of newborn babies outside the capital region. This funding will go to 51 regional hospitals that deploy specialists to treat newborns in neighboring areas. However, medical school staff and trainee doctors are maintaining their strong stance, especially following the election of Im Hyun-taek as the new leader of the Korean Medical Association. Im is known to be one of the KMA's most vocal opponents of increasing the medical school quota. During his first press conference on Friday afternoon, he said that doctors would return to their respective workplaces when the time was right. Hye-ryeon, Arirang News.